7. Sorry about that. Welcome class to another section of our video. This is module 7, and in this module we'll be looking at the mental health in diverse populations. So in our previous module we have been able to treat the meaning of mental health and different topics like the specialized professionals in mental health and like. So in this module we'll be looking at mental health in diverse populations. And when we're talking about diverse population, we'll delve more into it. It could be elderly person, the young ones, children, and the likes. So now we'll be looking at the contents of the module, where we have the meaning of mental health in diverse population. We have age-specific challenges and solutions for mental health in diverse populations. We will also, under that, we'll look at children, which ages from 0 to 12 in diverse populations, adolescent and youth between 13 to 24 in diverse populations. We also look at adults between 25 to 59 in diverse populations. Then we look at the elderly ones, which 60 upward in diverse population. Then after that, we also look at cultural and societal influences on mental health in diverse populations. Then we also move on to key cultural influences, societal factors and disparities. Also looked at the impacts of specific diverse populations. And lastly, we'll be looking at the strategies to address these influences. So these are the contents for this module, mental health management in diverse population. So now let's, for the introduction, we have mental health in diverse populations. It involves understanding how cultural, ethnic, socio-economic, and other factors shape experiences of mental illness, access to care, and treatment outcomes. So diverse population, on the other hand, it includes racial or ethnic minorities, LGBTQ plus individuals, people with disabilities, immigrants, refugees, and those in low-income or marginalized communities. So they often face unique stressors like discriminations, acculturations, challenges, and barriers to care. So these factors can influence prevalence, symptoms, and help to seek behaviors for conditions like anxiety, and not only anxiety, the depression or trauma. For example, we have cultural stigma around mental illness, which can reduce help seeking in some communities, while immigration-related stressors can increase risk for mental health issues. So let's move on to mental health in diverse population. What do we mean by mental health in diverse population now? Mental health, it manifests differently across different age groups with unique or different distinct vulnerabilities and considerations for children, adolescents, and elderly, influenced by developmental stages, social factors, and access to care. In children that age 3 to 17, nearly 1 in 5, that's 21%, have been diagnosed with mental, emotional, or behavioral health conditions, with anxiety affecting about 11% and behavior disorders impacting 8%, which often stemming from early life stressors like family dynamics or environmental changes. Positive mental health indicators are crucial here. So as early intervention can prevent escalation, though conditions like ADHD and depression are common and may persist if they are untreated. So now let's look at age-specific challenges and solutions for mental health in diverse populations. So when I'm talking about mental health challenges in diverse populations, it encompasses racial, ethnic, gender, sexual orientation, socioeconomic, and even cultural groups vary, which significantly across age groups due to intersecting factors. These intersecting factors could be discriminations, access barriers, and life stage stressors. However, these disparities they often result in higher prevalence or severity of conditions among marginalized communities that is excavated by systemic inequities such as racism, such as poverty and stigma. While also overall mental health trends show some improvements such as a decline in youth major depressive episodes from what we have in 18.1% in 2023 to 15.4%, percent, yes, in 2024. Now, persistent gaps highlighting the need for tailored interventions. Addressing this requires not only requires culturally sensitive approach, policy reforms, and community-based solutions to promote equity and resilience. So we are talking about age-specific challenges and solutions for mental health in diverse populations. It revolves around the kind of mental health challenges that people are facing that is mainly due to intersecting factors like discriminations and access barriers when they don't have access to some things and life stage stressors and all. So now let's move to children which ages from 0 to 12 in diverse populations. Now, children from diverse backgrounds, they face unique or distinct mental health challenges that is influenced by early exposure to adversity, which include family separation in immigrant communities, racial trauma, and socioeconomic instability. For instance, we have that approximately 19% of US children that aged 2 to 8 have one or more mental health disorders, with higher rates among Black and Hispanic children due to factors like poverty and discriminations. However, 45.8% of those affected, they do not receive services, often because of cultural stigma, language barriers, or lack of culturally competent providers. However, in global context now, children in low-income or conflict-affected regions, such as part of Africa or Latin America, they experience elevated risk of anxiety and behavioral disorders from environmental stressors like violence or malnutrition, while indigenous children may contend with intergenerational trauma from historical injustice, leading to higher PTSD rates. So now let's move on to adolescents and youth, which ages are 13 to 24 in diverse populations. Adolescents and young adults in diverse population or in diverse groups, they also encounter a perfect storm of mental health challenges, with nothing less than 50% of condition mainly beginning by 18, and it is driven by identity formation, trying to identify themselves, social media pressures, economic uncertainty, and discrimination. So when we're talking about mental health in a particular diverse population, we cannot take away discrimination from this concept because it is mainly one of the causes of this. So globally, we have 1 in 7 adolescents experiences a mental disorder, accounting for 15% of the disorder burden, with higher impact on LGBTQ plus youth and racial minorities. For example, we have the Black and Hispanic young adults, which age 18 to 29, report mental health crisis rates of 11.8% and 10.5% respectively. So now let's move on to adults, that is which are ages from 25 to 59. Now adults in diverse populations now. Working age adults from diverse backgrounds often grapple with mental health challenges that are tied to employment discrimination, family responsibilities, and chronic stressors, leading to disparities in conditions like depression and PTSD. Nearly 1 in 10 US adults, that's 8.9%, reported a mental health crisis in the past year, with rates higher among those with low income, 12.4% for under $45,000. And minorities, we have women, particularly in reproductive years, are twice as likely to experience depression, with postpartum issues affecting 1 in 7 new mothers in diverse community. So in this, we can easily deduce that that's working age adults. This is the year where adults believe they have to do more, they have to be more responsible. They push themselves more harder, and they also grapple with mental health. And these adults, they also grapple with mental health challenges. And these mental health challenges are mainly tied to employment, tied to discrimination, tied to family responsibilities, and all. So now let's move on to elderly. That's elderly in diverse population, and that has to do with 60 plus ages. We have older adults in diverse populations. They also confront mental health challenges. Uh, that is amplified by ageism intersecting with racism or cultural isolation, with approximately 14% of those aged 70 plus living with disorders like depression and anxiety, accounting for 6.8% of disability adjusted life years. Loneliness affects 1 in 6 globally, higher in minority elders due to family migration or elder abuse, while chronic illnesses and polypharmacy increase risk. In the US, only 15% receive adequate treatment, with disparities wider for non-white seniors facing provider shortages. We are in a situation where we have indigenous or immigrant elders. They may also deal with unresolved trauma that can lead to higher suicide rates. Now let's move on to the next subtopic, where we'll be treating cultural and societal influences on mental health in diverse populations. Cultural and societal factors, they also profoundly shape mental health experiences by influencing how individuals perceive, how they express and address psychological distress across diverse racial, ethnic, gender, sexual orientation, and socioeconomic groups. Now, culture encompasses shared beliefs, values, norms, and practices that dictate whether mental illness is viewed as a medical issue or not, and whether it is viewed as a medical issue or spiritual affliction or sign of weaknesses, often leading to stigma that deters help seeking. Societal elements such as discrimination, economic inequality, and access to care intersect with culture to exacerbate disparities, particularly in marginalized communities where historical traumas like colonialism or racism compound risk. Now let's move on to the key cultural influences now. Culture molds the etiology and phenomenology and interpretation of mental health, affecting prevalence and expression of disorders. In many non-Western society, mental health or mental illness may be attributed to supernatural causes, family dishonor, or imbalance in social harmony, leading to reliance on traditional healers rather than clinical services. For example, among indigenous groups, intergenerational trauma from colonization influences higher rates of PTSD and substance use, with healing tied to spiritual and communal practices. Religious beliefs also play a pivotal role. For instance, in Muslim communities, faith-based coping can buffer stress but also foster stigma if mental health is seen as a test of devotion. Family dynamics vary culturally. Collectivistic societies like those in Latin America or Africa emphasize family support, which can protect against isolation. Let's now address the societal factors and disparities. When we are talking about societal structures, it's including racism, poverty, and discrimination. They intersect with culture to drive mental health inequities. Racial and ethnic minorities, they often endure chronic stress from systemic bias, increasing vulnerability to disorders like depression and PTSD. For instance, perceived discrimination accounts for emotional distress among Black, Hispanic, and Asian adults compared to white. Economic factors compound. This low-income, diverse population face greater exposure to violence and instability, contributing to higher disease burdens. Stigma is amplified societally in communities of color. Mental health issues may be dismissed as personal failings, leading to underutilization of services. Now, let's look at the impact of specific diverse population. Influences vary across groups, which by highlighting intersectionality. In African American communities, for instance, historical racism fosters mistrust in healthcare with cultural strengths like kinship and spirituality that is mitigating some effects but not eliminating higher rates of untreated depression. Asian Americans may delay care due to model minority pressures and somatic symptoms focus, resulting in more severe presentation upon seeking help. Latino populations now, they often view mental health through familial and religious lenses, with acculturation increasing risk for substance use among youth. In global contexts such as sub-Saharan Africa, societal collectivism and traditional beliefs they lead to community-based coping but limited formal services, while urban to rural divides widen access gaps. Now we have the strategies to gain these influences. So in order to promote equity, this requires culturally competent approaches that does not only appear but also integrate diverse perspective into mental health system. Now training providers in cultural humility, acknowledging biases and adapting to patients' worldviews. It will definitely improve outcome by building trust and reducing misdiagnosis. Now, community-based interventions such as peer support groups incorporating cultural elements like spirituality or traditional healing, it enhances accessibility. Now, policy reforms also should expand diverse workforces in the sense that diverse workforces, for instance, we have more minority clinicians, so and address social determinants through anti-discrimination initiative and affordable care. Anti-stigma campaigns is tailored to cultural context, like those in immigrant communities, emphasizing resilience, encouraging help seeking. Now, finally, in conclusion, mental health in diverse populations is a multifaceted issue that is shaped by intersecting cultural, societal, age-specific, and systemic factors that perpetuate disparities in prevalence, access, and outcomes. From children facing early adversities like racial trauma and family separation to adolescents navigating identity what do we call it, identity crisis amplified by discrimination and social media, adults contending with employment biases and chronic stressors, and the elderly grappling with isolation and ageism compounded by cultural barriers. The challenges are profound and life